Gluteal muscle appearance and function can change with aging, often due to both muscle weakness and postural alignment issues. Today we're covering 2 exercises addressing gluteal development through pelvic alignment and targeted strengthening: wall hinge with lateral shift for pelvic repositioning, and wall facing squat with calf raise for gluteus medius strengthening. These exercises target muscle activation patterns and alignment essential for gluteal function and appearance. When practiced correctly and consistently, they can help improve gluteal strength, enhance muscle recruitment, and support functional hip stability. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have hip problems, lower back issues, balance disorders, or other health conditions. Understanding gluteal changes and pelvic alignment after age 50, several factors affect gluteal muscle appearance and function. Muscle mass naturally decreases with aging, gluteal muscles may weaken from reduced activity, pelvic alignment can shift due to postural changes and prolonged sitting, and neuromuscular recruitment patterns may become less efficient. While some age-related changes are normal, targeted exercises addressing both muscle strengthening and proper alignment can help maintain gluteal function and appearance. Research suggests that pelvic alignment affects muscle recruitment patterns, and exercises incorporating both alignment work and strengthening may be more effective than strengthening alone for improving gluteal muscle activation and function. Exercise 1, Wall hinge with lateral shift for pelvic alignment. The first exercise is wall hinge with lateral shift, focusing on pelvic repositioning and gluteal awareness. This movement addresses pelvic alignment while building mind-muscle connection with gluteal muscles, particularly gluteus medius. Here's how to perform wall hinge with lateral shift safely. Stand 6 to 8 inches in front of wall, facing away from wall. Position feet shoulder width apart with toes turned slightly inward. Keep knees soft, not locked. Place hands gently on hips. Begin hip hinge by pushing hips backward until buttocks gently tap wall. Maintain long straight spine, torso leans slightly forward naturally during hinge. In this hinged position against wall, shift hips slightly to left. Focus on feeling right gluteus engage. Shift back to center position. Then shift hips slightly to right. Focus on feeling left gluteus engage. Return to center position. Slowly stand back up by driving through heels. That completes 1 repetition. Perform 8 to 10 slow controlled repetitions. Rest 30 to 60 seconds. Complete 2 sets total. Practice 3 times per week. Critical technique reminders: movement is gentle side-to-side shift, not torso twist. Keep weight balanced in both feet throughout. Move slowly with precision and control. Think of gently rocking pelvis side to side. Maintain straight spine during hinge position. Modifications: for balance concerns, lightly rest fingers on countertop or chair in front for support. For limited hip mobility, reduce depth of hinge or amount of lateral shift. What to realistically expect: with regular practice 3 times per week over 4 to 8 weeks, you may notice improved awareness of gluteal muscle engagement, better pelvic positioning and control, enhanced ability to feel gluteus medius activation, improved hip stability, and better foundation for subsequent strengthening exercises. This exercise builds neuromuscular connection and pelvic awareness essential for effective gluteal training. Exercise 2, Wall-facing squat with calf raise for gluteus medius strength. The second exercise is wall-facing squat with calf raise, targeting gluteus medius and lower body integration. This exercise builds gluteal strength, particularly in gluteus medius, while challenging balance and coordination. Here's how to perform wall-facing squat with calf raise safely. Stand facing wall approximately 6 to 8 inches away. Position feet slightly wider than hips with toes angled out approximately 10 to 15 degrees. Place both hands lightly on wall at shoulder height for support. Begin lowering into squat position. Keep chest upright, knees tracking over toes. Lower to comfortable depth, ideally thighs at 45 to 60 degree angle, not necessarily full parallel depth. In bottom of squat position, rise onto toes lifting both heels. Engage calves and glutes during heel raise. Hold elevated position for 1 to 2 seconds. Slowly lower heels back down. Press through feet to return to standing position. That completes 1 repetition. Perform 10 to 12 controlled repetitions. Rest 60 to 90 seconds. Complete 2 to 3 sets. Practice 3 times per week. Essential form points: maintain upright chest throughout, don't lean into wall. Keep knees pushed slightly outward, activating gluteus medius. Move slowly, emphasizing control over speed. Face and knees should not touch wall. Breathe naturally throughout movement. Modifications: for limited squat depth, reduce how low you lower, even shallow squats provide benefit. For balance concerns, use firmer wall pressure with hands. For very limited capability, practice squat and calf raise separately initially. For progression, hold bottom position longer before calf raise. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice strengthened gluteus medius muscles, improved lower body integration and coordination, enhanced balance and stability, better functional leg strength for daily activities, and improved gluteal muscle tone and appearance for many. Targeted gluteus medius training addresses lateral hip strength often neglected in traditional exercises. Understanding realistic expectations for gluteal development. Gluteal muscle development after 50 requires realistic expectations and consistent effort. Age-related muscle changes: muscle mass naturally decreases with aging, muscle protein synthesis becomes less efficient, and body composition changes affect muscle appearance. Exercise can significantly improve muscle strength and function, enhance muscle tone and appearance for many, improve neuromuscular recruitment patterns, and support better posture and alignment. However, dramatic aesthetic changes may be limited, individual responses vary significantly, and consistent long-term practice is necessary. Realistic timeline: weeks 1 to 4 focus on learning proper form and building neuromuscular connection. Weeks 4 to 8 show improved muscle awareness and activation with possible early strength gains. Weeks 8 to 16 demonstrate noticeable strength improvements and enhanced muscle tone for many with continued progress. Maintenance requires ongoing consistent practice as stopping exercise leads to strength decline. Creating effective gluteal training routine. Here's how to integrate these exercises into effective routine. Practice both exercises in sequence 3 times per week on non-consecutive days. Sample routine: wall hinge with lateral shift, 2 sets of 8 to 10 reps focusing on pelvic alignment and muscle awareness. Rest 30 to 60 seconds between sets. Wall-facing squat with calf raise, 2 to 3 sets of 10 to 12 reps building gluteus medius strength. Rest 60 to 90 seconds between sets. Complete routine takes 12 to 18 minutes. These exercises work best combined with other lower body strengthening like glute bridges, step-ups, lateral movements, regular walking for overall health, and comprehensive fitness approach. Importance of pelvic alignment for muscle function. Proper pelvic alignment supports optimal muscle recruitment patterns. Common pelvic misalignments include anterior pelvic tilt, forward tilt, posterior pelvic tilt, backward tilt, and lateral pelvic shift, asymmetry side to side. These alignment issues can affect how gluteal muscles activate during exercise, which muscles compensate during movements, overall movement efficiency and comfort, and long-term joint health and function. Addressing alignment through exercises like wall hinge with lateral shift may improve muscle recruitment, making strengthening exercises more effective. However, significant structural issues require professional assessment and treatment. Complementary practices for gluteal health. These exercises work best as part of comprehensive approach including regular varied physical activity maintaining overall fitness, adequate protein intake supporting muscle maintenance. Older adults need more protein than younger adults, sufficient vitamin D supporting muscle function, quality sleep supporting recovery, stress management, and avoiding prolonged sitting when possible. Address multiple factors for best results. Safety considerations. These gluteal exercises require appropriate caution. Stop any exercise causing sharp pain, significant joint discomfort, dizziness or balance loss, or lower back pain beyond mild muscle fatigue. Consult healthcare provider before beginning if you have recent hip or knee surgery, severe hip arthritis, significant lower back problems, balance disorders or frequent falls, or diagnosed hip conditions. Always use wall support appropriately during exercises. Practice on non-slip surface. Start conservatively and progress gradually. Listen to your body always. When seek professional help, consult healthcare provider or physical therapist if you experience persistent hip or lower back pain during exercises, significant balance problems affecting safety, inability to perform exercises even with modifications, or no improvement after 12 weeks of consistent practice. Physical therapist can provide personalized assessment of pelvic alignment and muscle recruitment, specific modifications for your conditions, comprehensive exercise program appropriate for your needs, and manual therapy if needed for alignment or mobility issues. Realistic perspective on aesthetic changes. While these exercises can improve gluteal strength and muscle tone, realistic perspective is important. Aesthetic muscle changes after 50 are influenced by genetics and body composition, age-related physiological changes, consistency and duration of training, and overall lifestyle factors. Some individuals may notice visible improvements in gluteal appearance with consistent training. Others may experience significant functional strength gains with modest aesthetic changes. Both outcomes are valuable as functional strength supports independence, daily activities, balance and stability, and overall quality of life regardless of appearance changes. Focus on functional improvements and overall health rather than exclusively aesthetic outcomes. Monitoring functional progress. Track progress through functional improvements including easier stair climbing and chair rising, improved balance during daily activities, better hip stability during walking and turning, reduced hip or lower back discomfort for some, and enhanced confidence in movement capabilities. These functional markers indicate meaningful strength and coordination gains supporting independence and quality of life. Conclusion: these two exercises, wall hinge with lateral shift and wall facing squat with calf raise, provide targeted approach to gluteal development through pelvic alignment and strengthening. Wall hinge addresses pelvic positioning and neuromuscular awareness. Wall facing squat builds gluteus medius strength and lower body integration. Start at appropriate levels using all suggested modifications. Practice 3 times per week consistently. Progress gradually based on how your body responds. Use proper support for safety always. Maintain realistic expectations about outcomes. Combined with comprehensive fitness approach, adequate nutrition, and healthy lifestyle practices, these exercises can help improve gluteal strength, enhance muscle recruitment and function, and support continued hip stability and functional capacity. Thank you for watching. For specific concerns about appropriate gluteal exercises for your situation or significant pelvic alignment issues, consult with physical therapist or healthcare provider for personalized assessment and guidance. Subscribe for evidence-based information on functional fitness and strength training for older adults, practical guidance prioritizing safety while helping you maintain muscle health and functional independence through effective targeted exercises.